topic has quite a bit in breakout sessions after many support group Sundays of just somebody's experience and how it went and how frustrating it was. So we're going to be learning some best practices, some tips. We're going to hear from Cheryl. The handouts that you have in front of you, she will reference these. So if anybody didn't get one, please let us know. Some other items that I'm excited about for us to maybe do after the presentation, and it probably sounds funny saying it, but really want for us in advance to practice advocating. And you can do that with your spouse or your caregiver, or you probably call Joyce on the phone and she could role play with you. But really role playing when things aren't going well at the hospital and all these tips like medication advocacy and so forth. How are you going to advocate for yourself? What are you going to say? Because when we practice that and we prepare for it, it's a lot easier to do in real life. So that is something, just kind of keep that in the back of your mind. You've got paper and pens on all the tables. If you do have questions, please write them down and we will try to do questions for Cheryl at the end. Since she is virtual, sometimes that is just easier than kind of interrupting her PowerPoint flow. The other thing that we're going to talk a little bit about, well, a lot about, but is medication organization. So I just want to put a quick plug in that this isn't going to be large enough, and I realize that, but they make med sets that are very large and they have all different times of the day and several different compartments. You don't already have your medications organized. I strongly encourage you to do that. And also when we need to take them to the hospital, then it's so much easier than trying to figure out where all your pills are and getting them organized when we've got a crisis ahead of us. So, and then the other thing I just wanted to drop a tip in, and I'm going to hand this off to Cheryl, when it comes to advocacy, is therapy in the hospital. We've had a lot of families that have experiences and they may say something like, we didn't even have therapy. Therapy never came. Or when you have an emergency on the weekend, you never had a therapist come and see you. That is something that you might have to advocate for, is getting a therapy eval. And one of the reasons I love when families do that is if you do have a caregiver, we do this a lot for our families, home care partners. You have a caregiver that is with somebody and therapy signs off to say, yes, this caregiver can take so-and-so for a walk. They are safe doing so. Then they're more likely maybe to let you if you're able to get up and walk the halls or that sort of thing. But without therapy approving that, it's really hard. So that is something you might have to advocate for, is a therapy eval, especially if you're wanting a spouse to help you with transfers or walking or that sort of thing. So, yes.
I think Cheryl's information that she sent was quite nice, and I'd like to hear her tell how she got into this.
Absolutely. All right, Cheryl, your screen looks great and the audio looks great. I'm going to hand it off to you. And we are recording this and we will send out the PowerPoint probably Monday morning for anybody that would like to have the PowerPoint later.
Okay. Wonderful. Thank you all for having me today. My name is Cheryl Schinneberg. I'm going to enlarge my screen here so you can see my PowerPoint. I'm a Parkinson's Foundation ambassador, volunteer, in other words. And I just really thank you all for letting me come today. And just want to share information on the hospital safety guide that you all have in front of you. I don't know if any of you in the past had our Aware and Care kits, the little black bags. This guide is replacing that little black bag that we had since, I think, about 1999. They did a lot of research and in 2024 released this hospital safety guide to replace it. And I really liked the black bag. So I thought, oh no, this is not going to be nearly as good. But they did so much research and really listened to people. And this guide, I think, is so helpful. So I'm very happy to be able to present the information in it to you all. And it's just to help, as I've heard you all say, that there's a lot of frustration when you're in the hospital. And I worked in the hospital, I worked in outpatient and in home health, and I heard that consistently. So hopefully, with the use of this book, you will have some tips on making that go a lot smoother and the outcomes even better. And this is for whether it's a planned or an unplanned visit to the hospital. If you end up in the emergency room or you have to have an emergency surgery, or whether you already know that you're going in to have your hip or knee replaced. So either way, it helps you to prepare for that. Now, just to note that this is an educational, it's not intended to provide medical advice. So we definitely want you to consult with your physicians on your information, because we know everybody with Parkinson's is different. So just a little bit about the foundation and where this information is coming from. Our mission is to make...
Cheryl, you've shut off the PowerPoint.
Oh no, it's not there?
Nope.
Let me escape off.
We see you, but not the PowerPoint.
Well, that's not good. I don't know why it shut off. If it timed out or what. Let me get back to here.
No, it happened when you said you're going to increase the size.
Oh, okay. Well, let me see if this is going to share it again. Is it back on there?
Yes, it is.
Okay, let me see if it'll go. Are you seeing the full screen or the drop downs to the bottom? It doesn't really matter as long as you're seeing the main part there. Are you still seeing the full screen?
No, you're back.
Oh, okay. So when I enlarge it, it goes away. So I'm just going to leave it. Now you can see it right here.
No, we can see you.
Okay. I'm going to have to not enlarge it then. That makes it go away for some reason. Interesting. Okay. So now you can see it again?
Yes.
Okay. All right. So the Parkinson's Foundation, it's to help people live better with Parkinson's disease. And our goal is to advance research towards a cure. For some reason, my computer is doing all kinds of weird things here. There we go. And advance by advocating for best care, educating the community, both the healthcare community, people with Parkinson's disease, their loved ones, so that the care is improved throughout their life, and advancing research toward the cure. And in everything to do, we really want to build on that energy, the experience, and the passion of our Parkinson's community. So when they did this, this booklet, they really did talk with people and get feedback to come up with this. So we're advancing research towards a cure. Some of you may be involved in research projects, and we always need people to do that. You sometimes get amazed that they have a lot of things they want to test, but even trying to get 300 people to volunteer for a research project is difficult for them to do. And then to make life better, for people with Parkinson's by improving care. And that's really what I see, as we just talked about. People in the hospital, they've found in their research that when people with Parkinson's disease go to the hospital, they end up staying maybe 2 weeks longer than their peers. And about 64% aren't able to return home after their hospital stay directly. They either have to go to skilled nursing or rehab or assisted living. So we feel like if we can improve this hospitalization care, or whether it's an outpatient surgery care, or if you have to go to rehab or assisted living, you can use this book in all of those settings to advocate. So I really liked when Carla was talking about advocacy, because that's really what this book is there to do, is to help with self-advocacy. And we support a lot of research, and you're going to find that, like I just talked about. And again, that works towards what they did to figure out this book. So when the Parkinson's Foundation also has these global care networks and centers of excellence. So when you see on the map there, Missouri, we don't have a center of excellence, neither does Nebraska, but Kansas has a center of excellence. That's the closest one probably for you is at KU Medical Center. So those are facilities that went through a rigorous checking to become approved by the Parkinson's Foundation. What you do have there is a community partner through Home Care Partners. So that's something that has went through training and assessments by the Parkinson's Foundation and deemed to have a lot of knowledge to be able to help people with Parkinson's disease. So kudos to having that there in your community. That's a great resource to have. So the safety guide you see there on your screen, that's one of the free resources the Parkinson's Foundation puts out. There's also health sheets that are 1 to 2 page sheets on, I think they're about 40 some different topics, whether it's understanding Parkinsonism that you see there on your page, or what is Parkinson's disease, constipation, dementia, falls, blood pressure. There's a whole bunch of them. And then they have 3 books that are in print right now: Fitness Counts, Living Your Best Life, and Frequently Asked Questions, as well as the Hospital Safety Guide and then the Care Partner Guide. Any of those you can either call the Parkinson's Foundation helpline and order it at the 1-800-PD-INFO. You can also go to the library and download those sheets for more information too. So you have the hospital guide in front of you, but if you find you want other sheets to reprint out of that, which we'll talk about here in a few minutes, you can also go there and download some of those sheets as well. So my PD story is I graduated from PT school in 1985, and it happened that in 2013, we would just post any update things that we would see courses in our office. And I had seen something about Parkinson's disease. And through my career, I had went to lots of continuing education on stroke and backs and knees and hip replacements and all kinds of things. But I had not heard anything new on Parkinson's disease. So I happened to see that it said a 1-hour program on a Sunday. And I thought, well, I'll just go see what's new in Parkinson's, because I'm doing the same stretching, strengthening exercises, exactly the same thing that I did in 1985. And what I found out that I was actually at the 2-day certification course. I didn't read the whole flyer, obviously. And from them, people with Parkinson's coming in and working with a therapist during that course in 1 hour, I saw that I truly didn't know what I didn't know. There had been so much research in Parkinson's disease since I graduated in 1985. So I immediately went home and told my husband I had to find more courses on Parkinson's disease. And that was in August. And in October, I went to a certification course because I just found that nothing that we were doing in our facility was addressing all the new changes that had been found through research in Parkinson's disease. When I came back, I was living in Kansas City then at the time and got connected with the foundation, because I don't know how many of you all got information from your doctors when you got diagnosed, but what I was finding in all my outpatient patients that came in, or if I saw people in the hospital, when I started asking them the questions that kind of go along with Parkinson's and the signs and symptoms, frequently I would hear, I didn't know that was associated with Parkinson's disease. I didn't know any of this. Nobody ever told me. How come I never knew any of this? So I found I was using all the resources from the foundation to provide to them and have them order to get the free information to learn more so they could advocate for themselves. And then in 2021, I happened to be on a phone call with the foundation, but I had relocated to Central Missouri. And they said, we have this volunteer position if you would like to do it. And I said, I would love to, because they had given so much back to me that I could share with my patients. So that's the way I came to be in this position of volunteering. But I get to meet some great people and pass on some really helpful information, I think. So when we look, all these is in your book, all the information that we're going to cover. So you won't have, once in a while, I will direct you to a page to look at, but you can look at this down the road, and I really recommend everybody review this just to be more informed. But 4 out of every 12 people with Parkinson's disease will end up in the hospital in this year. And what they found is then that 3 of those 4 people won't get medicine at the right time, the right medicine at the right time. And that's going to, each of you in the room there has a different medication regimen. So, they can't really cut and paste and say, oh, well, we'll give you this medicine at the same time, because nobody has the same medications. And then out of that, 2 of the 3 will have complications resulting from that, not getting the right medications at the right time. So this was the reason for the Aware and Care kits, those black bags, if you ever had them, starting in 1999. And when I first started in 2021, that was my title, was Aware and Care Ambassador. And their focus was to try to get one of those bags in the hand of everyone with Parkinson's disease. And then with the research, they did change it and make a lot of improvements with this booklet. So once people end up in the hospital, what we find with people with Parkinson's disease, they start getting what we call a symptom spiral. And, you're going to be in every unit of the hospital. We think of somebody comes in with heart issues, they're going to go to the cardiac unit. And those nurses and doctors and therapists, the techs, they all know how to care for a person with heart disease. You go to the orthopedic unit, it's all, they know exactly when to give pain medicine, how to move those people with their total knees, total hips, or fractures. ICU, same thing. But a person with Parkinson's disease is going to be in all or any of those units. And just like I would not be the best person to treat your back or your sports injury, the nurses, they're very good at what they do, and that staff on that floor is very good at the focus for their unit. But the Parkinson's disease is such a specialized symptoms, groups of symptoms, that oftentimes we, as staff in the hospitals or outpatients, we just, like I said, I didn't know what I didn't know. So finding people that work with Parkinson's a lot, or in this case, this booklet is really, as she said, helping you to learn to advocate. And as you teach one person, whether it's one staff member, then it's going to help with the next person that comes to the hospital with Parkinson's disease. So what they find is when you go to the hospital, a lot of times, just like she said, therapy, you end up with a lack of movement. So symptom management can be even trickier because they just don't get that opportunity for movement. I remember an instance where a nurse called and she said, you have this patient and it's taking 3 of us to try to get this person out of bed. And I said, well, it's a new evaluation for me. Let me look it up, their history, and then I'll come down and do the evaluation. I'll call you back. So as I looked at the patient's chart, I immediately saw that they had Parkinson's disease. So I called the nurse and I said, they have Parkinson's. Have you given them their meds yet? And I remember that reply was just, well, but that's not going to make any difference if I've given it to them or not. So I thought, this is an opportunity for me, being from Missouri. Let me show you. So talk to her about, you get the medications. I'm going to finish my chart review. I'll come down while I'm starting the interview. You can give them the medication. And as I'm doing my evaluation, then we'll get them up to the chair. So, the plan was that that's going to help educate them that 3 people know if your meds, you haven't had your meds and you're in an off time, they're not going to be able to get you up, but get your meds on time and catch you at a good on time. Perhaps the person could get them up with just one person assist. So they're going to make their life easier, your life easier, less stressful, and your care partner's life, seeing you struggle, is going to be easier too, not to have that struggle to move. So then the medication issues, they may not be following the home schedule, which we're going to talk about. Maybe they don't have the medication that you take, and that's not unusual either, that it's not on the formulary for the hospital. And also, there are some medications that get prescribed that actually make the symptoms of Parkinson's disease worse. So looking at all those issues, we're going to talk about those too to help make the care of hospitalization improved. So then what we end up with, they lead to additional worsening of symptoms. It sets up that vicious cycle that puts a person at Parkinson's disease at risk for falls, pneumonia, and just muscle deterioration, stiffness, more anxiety. And then overall, it increases their dependence and lessens their independent status that they were at when they came in. So this is known as our symptom spiral while people are in the hospital. And we want you to be educated on what can go wrong and be prepared to explain how to avoid these missteps. And just being here and when we're talking about this today is that first step in progressing through this situation. So you have your book in front of you. And again, this is a free resource, and we really want you to go through it and be prepared before you need it. Then it's going to be something that you bring to the hospital as a tool during a medical emergency, or if it's a planned procedure. So when you look on page 4 and 5, that's one of the first things you're going to see after we talks about what we just talked about. But it gives you a step-by-step guide that you can check off as you go through when you prepare for your hospital, once you get to the hospital, and then when you're preparing to leave the hospital. So all that is outlined for you there so you can go through those things. And it gives not only the patient the empowerment, but also your care partner in case the patient isn't able to relay this information. So one of the first things is carry Parkinson's identification. That's step 1. You want to make sure that you or your loved one knows, in case of emergency, as much about you as they can tell others. So maybe it's a person that goes to your doctor's appointments, etc., that they can also relate that. So you might have a medical ID bracelet, maybe on your smartphone, you might have a communication about that. And, it can happen to any of us. Our car can break down. You can have a fall. Maybe appointments take longer, so your medication starts wearing off, so you are at increased risk for falls then. Accidents just happen to all of us every day, and they're going to happen to people with Parkinson's too. So one of the first things I will have you look at in your booklet is on the last page, page 63. It's a medical alert card, and these pages are perforated so you can tear out these cards. So on the medical alert card, most people will put that in their wallet, one of them, and then the other one, either their care partner can carry or leave it in the book so you have it as an additional resource there when you get to the hospital. So it talks about, I have Parkinson's disease, which could make me move slowly and have difficulty standing and speaking. Please call my family and physician. And then having all those resources there. And there's information down there. What is Parkinson's disease? Gives you some information on it. And importantly, on the back too, is it talks about meds that are safe for Parkinson's disease. Not that some people won't still have side effects, just like the general population with those, so they may not be able to take them. But then it also lists medications to avoid. So if possible, try not to give those. And these other ones on the left-hand side of the card are possible alternatives to that. So that's a very good resource. I've had people tell me they ended up in the emergency room for some reason. And when the doctor said, we want to give you this medication, they pulled out that card and said, can you please check here and make sure it's not on my medication to avoid list? Or I had another person tell me that they were planning for an outpatient surgery procedure. And when the anesthesiologist came in, they pulled out that card and gave it to him. And that, they said the anesthesiologist was very thankful because they said, we already had some of those meds pulled to give to you post-operatively if needed. So using that card, which is something very small that you can carry with you, is a very helpful card. So again, that's in the page 63 and it's just perforated and you can pull that right out. So that's step one, is get your identification. So the wallet card, a bracelet, or whatever works for you. And then step two is to prepare your go bag. So just a duffel bag, a little like the shopping bags. If you went to any Parkinson's courses, you probably got a bag at some of the pharmacology booths. A lot of them will pass out bags. So those work great. Just some bag that you can hang somewhere and know right where it is to take with you. And inside that go bag, you're going to have your Parkinson's Foundation safety guide. So the book, you're going to put it in there. And then we're going to talk about the other things. You're going to have a medication form, a signed doctor's letter, and we'll talk about that. And then current medications, they recommend that you have at least 2 days of your current medications labeled in the pharmacy bottles that are, again, current, not outdated bottles. And then a completed advance directive. So, you have your medical care preferences, and that allows someone you trust to speak up on your behalf also, if you're not able to. And if you have a DBS, also have your remote. Grab that and put it in the bag. So we're going to talk more about this bag as we go along and all the parts in it. But you think of it kind of like a maternity. The mother gets, expectant mother gets a bag ready to go. Same thing for Parkinson's. In order to be prepared, have your go bag. So when we look at the doctor's letter, and that's in your book now on, let me look at the pages here again. On page, sorry, got them marked. Lots of medication. You have, what 41. Is it? Oh, 41. Yes. That's the blank one. And then a little earlier on, it has a sample of getting it filled out and talking about it. On page 29. 29, it talks about it and it says sample form, and then it says tear out forms on page 41 and 42. So you can email it to your doctor because you can get it online at that Parkinson's Foundation, parkinson.org/library. So you can send it to them there. You can send it through your online portal, or you could bring the physical copy of the letter for them to sign. And what it talks about is really these 5 needs that we're going to go over, but it gives the doctor's signature, and it kind of gives you, I guess, a little bit of backup to say, I'm telling you, these are the things I need that we're going to talk about in the book, but here's where my physician agrees, and he's wanting to make these priorities as well. So that is on a perforated form in there. And then we recommend that you leave it in your book, in your bag, so you have access to it when you get ready to go. So the medication form is the same way. There's a sample medication form on and how to use it on page 27. And when you look at this medication form, you'll see that it lists the care partner for one thing, which is very important, and your doctors, but also just some special considerations. Do you have a dizzy feeling when you get up? That's not unusual for people with Parkinson's disease to get low blood pressure when they stand. Their blood pressure may be high when they're laying in bed and the nurse checks it, but if they're not aware that sometimes you're fine sitting too, but as soon as you stand, then you're going to be at higher risk when you get to the bathroom. By the time you get to the toilet, your blood pressure may have dropped. So they may need to do those testing of your blood pressures. Maybe you have trouble with swallowing, hallucinations, or delusions. So they may think you're confused and having difficulty at night when it's part of the Parkinson's disease. And then at the bottom, one of the most important things is if you look at the list, it doesn't say how many times a day. It says what time do you take it, what the medication is, the dose, and then any notes. So on your sample over there, like it says, I take my carbidopa, levodopa, immediate release at 8 a.m. And that's the dosage. And then with breakfast, I also take my Miralax. So that's one of the things sometimes at the hospital, you come in with your med list that says 3 times a day, but how the hospital translates that is not to how people with Parkinson's disease actually take their medication. So again, making use of that, which is a little different than a lot of the med lists that you might use. You can download the form, so you can also fill it out in the computer if you have some difficulty with writing, and then you can print it out if you have the printer at home. I would recommend making several copies. One of the things we have found with family members is they come with the ambulance. We give them a med list. We would get to the hospital, and the emergency room would say, do you have a med list? Well, we gave it to the ambulance, and they would say, well, they didn't give it to us. So then we would give them one, and then you get to the floor and the nurse would say, do you have the med list? Well, we gave one to the ambulance. So, have 4 or 5 copies because you're probably going to need that as you go through a stay in the hospital. We also found that our family members would all just take pictures of it also with their phone. So they had it easily available. So just having several of those and just making sure you update it every time the medication routines change, and make sure that it has your prescription medicines, your over-the-counter medications, and any medications that you take as needed. Maybe you just take a Tylenol or something for pain ever so often, but make sure you list all of those medications on there. So that form, looking at the sample, and then there's perforated forms that you can also use, and there's several of them there. Pages 33 all the way through page 39 has some extra medication forms that you can use. And then the last step 3 is choose a hospital care partner that can accompany you in the hospital. Again, someone who maybe is the person that goes to your doctor's appointments with you, or really knows what's going on, what your signs and symptoms are, what issues you have when you have an off time, just some of the little things that they need to know about you. And getting that go bag together by the time you get that. It's someone that you make sure too that you feel like they would speak up on your behalf, because that is something, like Carla said, that is really necessary. Is you have to have someone that will definitely speak up and let them know that you have some specific needs. That care partner, it's could be a spouse, it could be your adult child. It's the person that provides the most time supporting you as you've gone through your disease process. But you may have another friend or family member that could take that role if it's someone that, you don't have anybody that's close by in case of emergency that could get there to the hospital with you soon. They do talk about at the bottom there, professional advocates. I've never had anybody have that. It's somebody, I guess, you can pay for in that role, but it's not always covered by insurance, and it could be cost prohibitive. But just make sure that they understand your needs and that they have documents signed that they can speak at least on your behalf, or they can call your spouse or your daughter or whoever else, but that the doctor and nurses can talk to you also, because sometimes that's very prohibitive when you get there, and then they'll say, well, I can't tell you anything, or I can't listen to what you're saying. So just making sure that you have that all worked out before an emergency happens. So just preparing with that clear communication you and your loved ones need, it's just critical to being in the hospital. You can minimize the complications and the recovery time. Just like we talked about, 64%, aren't able to go home after a hospitalization, oftentimes just because of these complications that come up. So together, the Parkinson's Foundation has come up with these 5 care needs. And that's what we really want you and your care partners to be able to communicate during your hospital visit. So these are the 5 needs, and we're going to go through each one and give suggestions. And we'll spend a few minutes on each one of them. And it's when you go to the guide, it'll have this list, and then on each need, it gives you a 2-page spread with details about why it's important, what challenges you might expect, and then a quote from someone with Parkinson's or their care partner. And then it gives you suggestions for some real-time steps that you can take in the hospital to get that need met. We're going to focus on those real-time steps, and I really encourage you and your care partner to spend time reading and understanding each of those sections for you to get those needs met. So when we look at need number 1, I need my hospital chart to include my exact medications and reflect my at-home schedule. So when you look on page, you don't have to turn through each of these, but just for the example of what's in your book, page 10 is where this 2-page spread is for need number 1. So getting medication scheduled correctly into the medical chart is particularly important because the medication schedule, again, like we talked about, for every person is tailored specifically to what your needs are. In most hospitals, they will assume it's okay to give medications on the standard hospital schedule. So say you come in, if you just had your med list that said, I take my carbidopa, levodopa 3 times a day, they might give it to you at, I would say, 7 in the morning. And then if you do 8, that's going to be like 3 in the afternoon. And then again, like at 1 o'clock in the morning. So they'll schedule it for every 8 hours instead of maybe you take it at 6. So you're ready to get up and go to the bathroom and eat breakfast. And then maybe you're taking it at 12 and then at 4 or 5. Your schedule is specific to you. Now, some of the doctors that I have heard speak to this do say that sometimes in the hospital, your medications will need to change because you're ill and other things are going on. So it may not need to be exactly as it is at home, but hopefully they can have a neurologist or someone also consult with that to get those medications adjusted, someone who understands the Parkinson's medications. And I will say that was one of the trickiest parts when I worked in the hospital, and I would sometimes, if they had a neurologist consult or someone else, I would see it in a chart that they would have the medications at different times than what was taken at home. And I would ask the physician if they could please make sure that got corrected. So to help the hospital staff, understand, sorry, I need to change my screen, why it's important, the specific times. So share the forms that we just talked about, like the Parkinson's Care Summary. We didn't address that, but there are 10 of those, and they're perforated tear out sheets, and they are in your book from page 43 to 53, I believe. So there's 10 of those. And They are very helpful. I've even posted them in the room on the communication boards, or given them to the nurse to please post, on the computer in the room. Give it to them to put in their nursing break room, so that it gives them information on Parkinson's again and why it's so important. So that's one you want to share with them. You can share with them a copy of that doctor letter, or show it to them why it's necessary for the medication. And then have the medication form prepared well with the correct times for them to reference. You can also go to the next one here. Oops. Sorry, I keep moving. There it is. So share those 3 forms, the patient care summary. Again, you can tear those out, your doctor's letter, and a medication form with them again. And then verbally reviewing it with the nurse, and even asking, can you show me their medication list that you have in the computer, so that you know when they're taking it, when they have down specific times for them to take, rather than the number of times per day. And then offer the home pharmacy prescriptions, the home prescriptions. That's where we talked about in your go bag having 2 days worth of your current medications in a bottle that's labeled from your pharmacy. And that's not uncommon with a lot of medications, that they don't carry them at the hospital settings, which really surprised me a few years back. I did not realize that. But even my mother, who has diabetes, when she was in rehab, they didn't have 2, I would think of as pretty common diabetic medications. So we did that, brought in the bottles. The pharmacist, the nurse will give it to the pharmacist, and they check it and make sure it's the right medication that matches the bottle. And then they dispensed it to the nurse, the pharmacist did, and the nurse would give it to my mother. And then when we left, we just made sure that we got our bottle with any remaining medications. So that's not uncommon that the pharmacy does not stock all of those medications, but it's important that we try to get what you take if possible, because it's not apples to apples when you're having, extended release or sustained release or immediate release. They can't just switch those around. So if you have the Parkinson medication on hand, offer their home prescription. And, if a substitution is made, it just doesn't end up exactly the same. And that can have an impact in some cases. So having the correct medication in the bottle makes it much more likely that you'll get the correct medication then. Okay. So then the need number 2 is I need to take my Parkinson's medication within 15 minutes of my usual schedule. And that's really hard in the hospital, because you might be going to a test at the usual time that you take it, or you can't have anything by mouth because you're getting ready to go to your test. So it's just difficulty, as well as the nursing timing. So nurses in the hospital, normally they have up to an hour outside the schedule of the medication time to get the medications, and it still be considered on time. So the goal of the Parkinson's Foundation is to get some get hospitals on board with people with Parkinson's disease getting that medication within 15 minutes of their usual schedule. But that's a big change for hospitals that allow that hour window either side of when it's in the computer to be given. Depending on the individual, even a small change in medication timing can worsen symptoms, control, and slow recovery. So if you think you were supposed to take it at 7, and then 12, just as an example, if they gave it to you at 6 because of their schedule, they were in there and said, okay, with nursing shift change, I'm going to go ahead and give it to you now. And then your next dose, instead of being at 12, is at 1. Instead of that window, you're having 2 extra hours in there. So you might potentially have an off time, which the same thing if you were going to get it at 12 and 4, and instead they didn't give it to you till 1, and then they say, well, we're going to give it to you at 3:30, then there could be that possibility of having dyskinesias because you're over the medication. You've had your doses so close together. So that's where, if they don't understand, especially in people who have had the Parkinson's disease for longer times, initially maybe people only take their medications twice a day, but then there are people that get down to where they're taking it every 3 hours. So the timing and not getting them too close or too far away with the on and off times is very important, because those delayed or missed doses, again, we're coming back to what are the complications: falls, difficulty participating in rehab, pneumonia. You're not able to communicate as well sometimes. So you're just being less prepared to go home again when it comes that time for discharge. So what can we do about that? Explain, why missed medications are such a problem, how you get to an off time very quickly, and what happens during your off time. Some people can still move some, but they start being very, very anxious as their off time gets near. So it's just, everybody's different. So that's where that care partner that can communicate all that with you. Do you have pain when you get next to an off time? Be specific. What happens if those medications aren't right on time? And offer some reminders. Again, nurses may not know about that. And again, things happen. Maybe somebody fell and they had to take care of that, or somebody had a medical event, so they get pulled away and they don't get to the room right at time. That certainly happens. It's hard to keep a schedule at the hospital for sure. But give them kind reminders if you can, to remember that, the person has Parkinson's disease, and to please try to get it to them if they can. It's different than other people they're caring for. And then how to follow up with that, again, giving them Parkinson's care summary, show them the doctor's letter, and review the medication form again. And just kind of, it's not just a preference, but it really is a need for people with Parkinson's disease. So need number 3 is to avoid medications that make the Parkinson's disease worse. Some of those are medications that block dopamine, and they might be given regularly at the hospital to manage confusion, agitation, nausea, and GI problems. And they are safe maybe for a lot of people, but for people with Parkinson's disease, they do not have the same response. There's a lot of problems that can arise from that. So, and just if they know more and your care partner can explain things, a lot of times people with Parkinson's disease have REM sleep disorder, or they've been in bed and haven't been able to get out. They might be stiff and restless and having pain, but oftentimes a default medication, this person's having trouble sleeping, is they give them something like Haldol that, that they think, well, this is what we usually give, but for someone with Parkinson's disease, that can be dopamine blocking. Many hospital professionals just give those medications without a lot of hesitations, like the example I gave with, the anesthesiologist. Some of those GI nausea meds are common that they give post-operatively when somebody has something. So they don't realize that with Parkinson's disease, that could be harmful. So same thing, looking at the real-time steps, reveal the list of medications. You can use that wallet card, or you can use that Parkinson's care summary. Again, it had it. You can use that tear-off sheet. Whenever there's a new medication prescribed, again, review the list. Like that example I gave with the person in the emergency room. She said, can you please check my list and make sure? Same thing with the anesthesiologist. And just check. Just watch for medications that are prescribed before and after surgery, because they are sometimes automated, and a digital checklist that doesn't really catch that it's not the best for someone who has Parkinson's disease. Some of the computer programs like Cerner and now I'm drawing a blank on the other one, the Parkinson's Foundation has been working with. So if when someone is admitted to the hospital, it flags that they have Parkinson's disease, and it will ask a series of questions like, please ask them when they take their medications. And some of those medications would trigger it through. But, it has to be activated within the system. And then the people have to put it in to be utilized. But that was a goal too with the foundation, to work with hospitals and get that triggered so we improved care for our patients with Parkinson's disease. Review the interactions and then just tell them, advise, see if they can find an alternative using that list that you have there. And these next two are the ones that I was really excited about when we went to the book from the bag, because these were not identified earlier as needs for people with Parkinson's disease. So I need to move my body as safely and regularly as possible, ideally 3 times a day. And a saying that's heard a lot in therapy is, if someone stays in bed for 1 day, then it takes 3 days to kind of recover back to that point. And I've heard neurologists say for Parkinson's disease, if you stay in bed 1 day, then it may take 7 days to get back. So it's really essential for people with Parkinson's disease. Although, there's times when you have to be in bed. There's a fracture or there's other things they're checking. They need x-rays, they need CAT scans, that they can't get you out of bed. But if it is possible, it's ideal that we try to get you up, and 3 times a day, if at all possible. Again, these are all outlined in your book. And we just know that movement, as you all know, movement is so important in symptom management. I'm sure you're all involved in some type of exercise. So as our PT saying is now, motion is lotion. Instead of no pain, no gain that they used to talk about therapists, now we use motion is lotion, which is a lot more positive. But the hospital team, they might be more worried about you falling and getting you up, or like I talked about, the person the nurse who hadn't given them medications and 3 people were trying to get someone out of bed. So educating them that, give me my medications, and then about 30, whatever it is, 45 minutes, I'm able to move a lot better. So again, this is a place that you can self-advocate with any of these. Staying active in the hospital in a safe, appropriate way is the key to maintaining abilities and recovering faster. So communicating your needs, again, using the care summary sheet, the doctor letter, just point to what your symptoms are and how the medication can help so that you can move with a decreased risk for falls. If you can get up and just being able to walk to the bathroom, getting up and getting dressed a little bit, maybe you put on a sweatpants or something so it's not just the gown. Dressing, getting up in the chair for meals, upright is always better for your swallowing, whether it's medications or you're taking in a full meal. And request, again, as Carla was saying, requesting that help from therapy, physical therapy, occupational therapy, to help you move safely. Even in the outpatient setting or in the community, when I've visited with people that, just wanted information on Parkinson's, I hear them say, I can really tell that my balance is off and I'm having trouble with this and that early on in the disease process. And several times I've said, well, have you seen therapy to work on some of those things, whether it's dressing through OT or physical therapy for balance and gait? And a lot of them say, no, but I go to the doctor and they'll just tell me if I need that, right? And so, I say, no, not always. You have to ask. And just like Carla said, don't hesitate to ask, can I get a consult for PT and OT? Same thing if it's outpatient, if you feel like you're needing something. And And I've had people come back to me then a month later, wow, I've started therapy and I'm moving so much better. So there really is benefits now that, again, I would seek out someone who is trained that works with Parkinson's a lot. Because if you'd asked me before 2013, I would not have been doing the most optimal therapy program for Parkinson's. But now that I've had extra training in that, so I would seek out someone in both of those, PT and OT, that work with Parkinson's a lot and are more trained. It's not going. Sorry, my screen doesn't want to move. There it goes. So need number 5 is to screen for swallowing changes. When you have difficulty with swallowing, it's called dysphagia, and it's common for people with Parkinson's disease. It can lead to choking or aspiration. So when you swallow, instead of it going down your esophagus and into your stomach, it goes down the trachea and into your lungs, and that can often cause an infection. So that is caused aspiration pneumonia, and it can be a frequent cause of death for people with Parkinson's disease. They get the aspiration pneumonia. It can also, if it's not going down the right path, can cause weight loss. So identifying the swallowing challenges is an important way to prevent aspiration pneumonia. But it also, sometimes when people think, oh, you might be choking or swallowing it down the wrong way, sometimes they will put in an order for NPO, or no food by mouth. And that can limit a person with Parkinson's ability to take their medications. But usually there's a safe way to get your medications. And in your hospital safety guide on, it's towards the front here, there is a page that talks about how's the safe way to get your medications the best way. So it'll talk about alternatives, whether they crush it and put it in applesauce. How's the best way that you can still be getting your medications? Whoops, sorry, got to go back one. So tell the staff, these are those real-time steps again. Tell them, you or your loved one, that you've had swallowing problems in the past. Ask for a speech language pathology consultant. They might do a bedside swallow study or do a video swallow study. Some of you might have already had those. Try to avoid those medication pauses. So see if there's an alternative to that. Maybe you can take a little sip of water or crushed. But we want to really decrease the risk of having aspiration. So making sure the person sits up for meals and medications. How sometimes they try to give you medications when partially reclined in bed. So we really want people sitting upright, preferably in the chair. And taking small bites, that can be helpful. And then also making sure that they brush their teeth. Sometimes I know in the hospital that wasn't offered very often, but it's really important to brush the teeth, the tongue, and the mouth before and after eating. That way, if there is some aspiration going on, there's not so much bacteria entering the airway, which can lead to the pneumonia. So I'm going to put on, just kind of as a review of the bag here, a little video, if I can get it to play. Maybe not. There it goes. By one of our other ambassadors.
Hi, my name is Mark Milo, and I have Parkinson's disease. I'm also on the People with Parkinson's Advisory Council, and I'm here today to show you how to make a hospital go bag so that you'll be prepared to go to the hospital on a planned or unplanned visit. It sounds a little intimidating, but it's very easy to do. You start off by ordering a hospital safety guide from the Parkinson's Foundation. You can do this by calling the hotline, very easy to do. Then you want to find yourself a go bag to use, right? But if you're anything like me, you go to a lot of Parkinson's events, so you can get one of these little duffel bags or these little carry bags. That makes a great go bag, okay? And what do you put in there? Well, again, your hospital safety guide. Now, the other forms I'm going to be discussing right now are all found in this hospital safety guide in the back. You'll want a medical alert card. And again, this is found in the back. Just make sure that this is completed, identifying yourself as a person with Parkinson's disease and specific medical needs. Also, you'll want to have this note filled out. You take it to your doctor on one of your visits. It's a note for your doctor to sign and complete saying you have special medical needs because you have Parkinson's disease. And a current listing of your medications. Now, you want to have your Parkinson's medications on here as well as other medications, but don't just put how much you put in there or how much you take. Make sure you put down the times that you take them. That's going to be very important in the hospital. And make sure you have 2 days dosages or 2 days worth of your Parkinson's medications, my levodopa and my pramipexole, okay? They have to be in the pharmacy labeled bottles. That's also very important. Make sure those are in your bag. And make sure you communicate this with your care partner. And choosing and selecting a care partner is very important to do. There's some tips and tricks in the hospital safety guide on page 8 on that subject. So there you go. It's as simple as that. Now you want to put this bag in a place where everybody knows where it is, and it's easy to grab on the way out. Let me show you where I store mine. Come on. I keep my go bag in an entry closet, so it's very easy to grab on the way out the door. So there you have it. Your go bag is all set and ready to go. You've got your hospital safety guide, you've got your medication form, your doctor's note, your medical card, and your prescription bottles all in one place in your bag, ready to go. It's as simple as that. Remember, being proactive is the key to navigating a hospital stay when you have Parkinson's disease. So guys, be prepared, stay informed, and remember to stay well. Thank you so much for watching.
Great. So the other thing I would refer you to on your guidebook, get this to change here, is on page 7. And if you've, went through all these steps, this is on page 7, you've went through your 5 needs, you've reviewed all that, you've tried the steps in there, is first of all, discuss the concern with your primary nurse. Then if that doesn't seem to have an effect, involve the charge nurse, ask to meet with the doctor who may consult with a neurologist, pharmacist, your Parkinson's doctor, and then if needed, ask that your concern be noted in the chart and to speak with the patient care advocate. So they're working to give you the best care, but again, they if they've not had experience with Parkinson's disease, just like with the movement, the more you're in bed, a lot of times with Parkinson's disease, a common symptom is constipation, and being down in bed even increases constipation a lot of times. Movement gets the gut going too. So, assume again that your care team is doing the best they can with the information and the tools that they have. They're good at what they do, but Parkinson's is just a different diagnosis to consider. And their goal is to get you better and return home safely. But be honest, direct, and respectful when you communicate your needs. So I really like that page 7, reviewing all that. Again, you can order additional ones of these or other handouts that the Parkinson's Foundation has. Hopefully now you understand kind of those 5 Parkinson's care needs and have your safety guide now to start your own bag. If you know someone else that needs one, definitely have them get in touch with the foundation. And those resources, there's all kinds of resources available by going to parkinson.org or the helpline. The helpline is open from 8 to 6 Central Time, and it's staffed Monday through Friday, and they're very helpful. I've called, I had someone looking for a Parkinson's support group where it was for care partners, not for people with Parkinson's disease. And they looked that up and let me know just on that call. So they're very good at finding you information, and you can either access their questions through the question helpline at parkinson.org, or you can call them through that. So again, thank you. And I'll take this screen off, and then you tell me if there's other things that I covered quickly here. Sorry. There we go.
Cheryl? She did
Yes.
great. I'm gonna ask now if there are any questions from the group.
Questions, comments? Everybody has a guide, hopefully.
Yeah, I think Carl's done a good job of getting.
I'm from another state, I'm visiting to us, but I want to make sure that you understand that when you go in as an advocate, or when you have someone who will go in with you as an advocate, they have a proper standing. I tried to go in with a neighbor and I was completely disregarded. You need to have somebody whose power of attorney has been violated. It's very important that, you had suggested just get somebody to come with you, Carol, but it may not be a person who will be accepted by the hospital.
Yeah, they have to get on the list that it's someone you can speak with, that has to be approved, that, somehow get them on that list of who can you talk to about the situation.
Well, in this case, her son was in Florida, she was in Illinois, so it would be good to have a second person.
Yeah.
She mentioned her. I don't know if she mentioned it or not, but we go to a safety guide anyway with the private hospital, and there's some ladies talking about insurance. Was there insurance talked about in this thing?
No, the only thing that I spoke about with insurance is they said sometimes people can have a paid advocate to speak for them, but they didn't think that was covered by insurance. I've never known of anyone that had one of those paid to go with them, but that is in the booklet here that it covers that might be an option to have someone paid as an advocate.
More questions? Oh, here's one.
This is an insurance question also, and asking for rehabilitation therapy so that you're getting up 3 times a day, and especially on a short stay. Is that ever a problem with Medicare, or your insurance company paying for that if they don't think it's needed?
In the hospital, I don't believe it's an issue as far as I've ever seen. Something to ask, but a lot of those are bundled when you go in with the diagnosis that it kind of pays a certain amount for your stay. It would be something to ask. I never had that issue when someone was in the hospital that we saw that their insurance wouldn't cover it. Now, if you went for outpatient or any of those, yes, you would have to consult with the insurance company for certain to get that covered.
Any more questions? Cheryl, thanks again so much for Zooming with us and for the education. And I have my little black bag, and I was kind of sad to hear that they went away, but the booklets, I've got one of those too, and so they're helpful. And like you say, we can find them with that black bag somewhere.
Mm-hmm. Well, and I think people, they, you'll probably have to talk to every person that comes into the room, every shift. You'll have a different nurse the next day or a different night shift nurse. And I know people say, well, I've torn all my pages out of my booklet because I just have different staff members every day, every shift. And if you can educate one person, you're going to make it easier for you and then for the next person with Parkinson's that comes in. One of the persons who had the bags a few years ago before we went to the book, he said, I've been in the hospital for multiple different reasons and to skilled nursing. And he said, I think we're getting the word out gradually. Cause he said, the last time I went to skilled nursing afterwards, I had 3 staff members come in and say, hey, we understand you have Parkinson's disease. What can we do to help you the most? So he said he always just took his bag and his booklet. So whether you're going to rehab, skilled nursing, outpatient surgery, whatever, having all the information that you can have and being informed is definitely going to benefit your outcome. And thank you all for letting me.
In the little black bags, the forms weren't quite as big. I would take them, those medication thing and hang it in his room, and it wasn't quite as visible as some things we have in the booklet now. So I think that would be helpful.
Yeah, I like the large print. I like that.
That's right. So again, let's give her a round of applause for.
Well, thank you all for being here. You all have a great rest of your meeting.
Thank you. Thank you.
Mm-hmm.
Just a couple of things. If you happen to have the book with Dr. Ray Dorsey and Dr. Kuhn, if you finished it, please bring it back. For Jim, where's Jim? So that other people can check it out. Also, October 30th is the symposium, our annual symposium with UNMC. And we haven't gotten the registration yet, but it should be coming. So when it does, we'll all share it and go from there. Next month is durable medical equipment with Energize. That's always helpful to know because I've noticed that a lot of new equipment is, yes, am I mistaken?
30th, not October.
November 30th? September. Sorry. Okay, September 30th. Thanks, Zach. The September 30th. So yeah, we should be getting those registration forms soon. Also, we're really thankful for the Parkinson's Foundation and all the information they have. And it sounds like it's pretty easy to get this stuff. Carla probably has most of it right here in Lincoln, but you can always go to the site and ask for things to be sent to you. Are there any other announcements? Anyone would like to share something? Well, once again, we want to thank Gunter for doing the Zoom, and Jim, we have our little library over here, so take a look because poor guy has to pack it up every time and bring it out and put it out every time. So look at that. And Sally, thanks for the refreshments. And Sally's just telling me today, we've given out a lot of those brochures to try to educate the population. And she's just got out, so she's going to get more printed up. We also have the business cards that you can share. So we want to get the word out that we are around to help people through this journey. And so thank you all for coming. I hope you'll be here next month. We may have some new people. When we divide up into groups, make sure we get to know those people. The people with Parkinson's will meet in here, and the caregivers will meet in the kitchen. And on your way to either place, have some refreshments.